Republican Congressman Andy Harris. He serves on the House Appropriations Committee and the Health and Human Services Subcommittee. Sir, it's good to have you here. And the rollout of the ACA website, it was flawed. The desire, the need for affordable health care in this country, Americans want it. Because we know from the latest Washington poll, ABC News poll, finding out that 46% of voters support Obamacare, 66% say the law should stand. Meanwhile, the views of the Republican Party are at an all-time low with a 63% unfavorable rating. Do you think that it's politically smart of Senator Rubio to offer up another bill to delay the health care law right after the disaster over the shutdown with the health care law?
Oh, absolutely. Obamacare is still foremost on the minds of a lot of Americans, not only those that are having trouble getting on the exchanges, but those who don't really have to get on the exchanges, who are getting their premium increase notices. Many people, their policies that they've had for years, they're getting notices they can't get them anymore, and the new policies are 50%, sometimes 100, 150% more than the old ones.
When we look at what's happened, though, there are Republicans that are getting mired down in the temporary challenges, overlooking the long term of the benefits here. Because as we've seen in your own state, like also in states like Kentucky, there have been great surges for sign-up. I just want to play a small part. Kentucky's governor, Steve Beshear, what he had to say about what's going on in their state this morning.
Let me just give unsolicited advice to the critics and, honestly, to the news media. Take a deep breath. You know, this system is going to work. The only thing that really isn't working right now on the federal level is the website. I'll guarantee you that whether it's a week from now, a month from now, 2 months from now, they'll get it up and they'll get it working. People will be signing up.
So he's talking specifically about Kentucky. If we look specifically at your home state of Maryland, approximately 750,000 people are uninsured. Hundreds of thousands, though, have visited your state-run exchange. Tens of thousands have created their accounts already. And this is because the governor there, Martin O'Malley, accepted the law and started the Connector program through a state-run exchange. So clearly there's an interest in the ACA. So wouldn't you agree that it's worth the ride-out of the growing pains to get this all figured out?
Look, in Maryland, for instance, there are just over 2,000 people have signed up, which is half of what was projected. So it's not the computer system isn't working in Maryland either to sign up. But again, it's not just that it's not just affecting people who can't sign up on the websites. It's affecting people who are getting those premium increases and employers who are now afraid that the employer mandate will kick in a year from now. Remember, the president only delayed the employer mandate tax, not the individual mandate tax. So we still have, down the road, next year is going to be very rocky for businesses and the economy as the second shoe drops.
But isn't that the time necessary to get people in? Again, this is trying to make health care affordable and accessible to those Americans among us who have not had it or have not been able to afford it. And I know as a doctor yourself, and what you've seen through your years coming up, don't you agree, though, that more Americans would benefit from having lower premiums, and our premiums are based on how many people are insured? And most of us have been getting our premiums because of the uninsured that show up in the emergency rooms.
But we're getting our premiums raised now as the Affordable Care Act goes into place. Remember, the President said that the families are going to pay $2,500 a year less. And this year, according to the Kaiser study, they paid $2,500 a year more for their insurance. And this is all in anticipation of the increased risk pooling with Obamacare, because I have to disagree with you. I don't think young people are going to buy the insurance. You know, in Maryland, the cost went up 50% for young people, so even if you get a subsidy, you're still paying more than you were before.
But with the mandate that's included in all of this, there is the encouragement there, and we've seen how this works in Massachusetts. There is a state, there is a place where this has been working since 2006, where nearly 100% of the people there, children and adults, are insured. And they don't have the harsh problems that are being discussed in other states, you know, as we're seeing where the rollout has had its hiccups. You know, Massachusetts is a prime example of where this actually works.
Well, you know, the problem in Massachusetts is that the health care premiums are going up, and I know from my physician colleagues are leaving the state because they're trying to squeeze the reimbursement. You're not being able to see the physician who you want to see. That's how cost savings are done. And again, the president promised you can see, you know, if you like your doctor, you can see them. But in Maryland, you can't even go online and tell whether your doctor is on the plan you're signing up for. It's that big of a computer glitch. Even the lieutenant governor said Maryland had a stumble. I would say that's being very generous.
But don't you think that with doctors, and as you're talking about in Massachusetts, that there is a way, and not through volume billing, but through value billing, and to make sure that people are charged properly for the needs of their medical concerns, that there is a way to make this system work.
Here's the problem. It's the government deciding your value, what's valuable to you. If you like your physician and the government says that your physician is not providing value to you, it doesn't make a difference what your opinion is. Your physician's going to be paid less, probably won't be in the plan that you're in, and you probably won't be able to see your physician.
Congressman Andy Harris, sir, thanks for making